Now, welcome to this product demonstration video where we're just going to show you what you get and how to perform a saliva drug test. This product is the direct saliva 6-drug combination from UK Drug Testing, manufactured by All Test for us. This combination has 2 3-panel drug strips loaded into it, and it screens for cocaine, amphetamine and methadone, opiates, methamphet and cannabis, and it's also got an inbuilt saliva indicator in it. So this is the foil pouch. On the outer aspect of that you'll see the drug abbreviations along the top. You've also got the coding for the kit, which is DSD-863. That coding is used for all different combinations of this design, so it's not specific to this particular combination. The batch number or lot number in the centre, and the expiry date of the test or best before date, and along the bottom are the standard CE certification marks. Inside that foil you'll get a little pouch of desiccant which keeps the test membrane dry in storage, and then this is the test cassette. And if I just bring this closer to the camera, you'll see, if I invert it, you've got the C indicators for where the control lines form, and then the drug abbreviations for the 2 parallel membranes, and a yellow beige saliva indicator pad. The cover over the saliva collector has to be removed before you give it to the donor. This tongue you should not touch before it goes into the donor's mouth, but you then need to wipe that well around the mouth, on the top of the tongue, underneath the tongue, between the gums and the cheeks, top of the teeth, bottom of the teeth. You basically have to work that around the mouth really well, and that's particularly critical if you wish to detect cannabis accurately or reliably with this, because that will not be excreted into the saliva as a metabolite. You have to catch it onto that tongue membrane directly from deposited drug in and around the mouth and oral cavity to detect that accurately. But this test is then worked around the mouth and placed under the tongue until the saliva indicator turns blue, and you can see the pink dye running up towards where the C lines are indicated on the marker. At that stage it can be removed and the cover put back onto the test, placed on a flat surface and read at the appropriate time. So what we're going to do now is saturate this in saliva sample and show you that indicated colour change and the results, and talk you through interpretation of those.